Hello, everyone, and welcome to another episode of Humanitarian Horizons. As you know, I am Christina DiArcangelo. And with me today, we have a special guest who is located in South Carolina in the Attorney General's office, and his name is John Frampton. Thank you for joining us today, John. I appreciate you joining.
Thank you for having me. I appreciate the opportunity to come and speak with you and your listeners.
Thank you so much. So, for everyone out there that follow Humanitarian Horizons, I often speak about elder abuse, whether it's elder financial abuse, elder exploitation, elder abuse in general, because of the fact that crime was committed against my mom that I've shared with everyone. And I've talked about the backstory. And then I ended up writing the book, Rescuing Mom, all about elder abuse, financial exploitation, and mental health. So we started working through Affinity Patient Advocacy on our first South Carolina, actually Charleston, South Carolina elder abuse case. And I had filed multiple complaints with multiple authorities and had the opportunity to meet John and to discuss that case and to learn about what his group does. How do they prosecute? What is their purview? And I thought it would be a good idea for John to explain those things to everyone so that people, at least in South Carolina, have an understanding as to what goes on. Thank you, John, for joining us.
Yeah, absolutely. So we are the Vulnerable Adult Medicaid Provider Fraud Unit at the Attorney General's office, also known as VAMP. We are what's called a Medicaid Fraud Control Unit. So every state in the country has a MFUCU or a Medicaid Fraud Control Unit, and it's federally funded. We investigate doctors, dentists, counselors, anybody that provides that Medicaid fraud service. We have jurisdiction over those. So our federal component of that, our federal funding, also allows us to do some vulnerable adult work. So we have jurisdiction by the federal government and through OAPA, the Omnibus Adult Protection Act in South Carolina, for vulnerable adults that reside in a residential care facility. So anybody who lives in a skilled living facility, skilled nursing, assisted living, CTH, we would have jurisdiction over those victims, vulnerable adult victims that are victimized in those facilities. So something like financial exploitation, whether that's occurring inside the facility from somebody that works inside or somebody that works outside, or it could be a family member. Also abuse and neglect that happens within that facility. And to just kind of talk a little bit about our unit. So we have 14 investigators. So all of our investigators are Class 1 certified law enforcement officers in the state. We're fortunate enough to also have a registered nurse who's a Class 3 law enforcement officer. And we are the only unit in the country that I know about that has a licensed pharmacist who is also a Class 1 investigator. So we're really fortunate to have some really skilled, seasoned investigators here. But we also have 3 financial auditors that help with our Medicaid provider fraud, but also with bank records from financial exploitation cases. And we have 5 in-house prosecutors that prosecute nothing but our cases. So we have 2 lanes, right? We have the Medicaid provider fraud, where we can talk about it at a later time. But on the vulnerable adult side, for us to have jurisdiction, they have to be in a facility. There's some other state agencies that also have similar duties. SLED, State Police's Vulnerable Adult Unit, they have jurisdiction of state facilities and state contracted facilities for Department of Mental Health and Department of Disabilities. And I guess you could say we have jurisdiction of the private and everything else. Looked like you were going to ask me a question earlier. So
Yep.
I don't want to jump on your toes, Christina.
Thank you. Yes, I was going to ask you a question. Would you say over the past couple of years that you've seen an increase of complaints coming in to your organization regarding elder abuse?
I think so. And I'm not going to say maybe that vulnerable adult crimes are on the uptick. I think there's been more awareness. We have done a lot with outreach, not only with like local law enforcement outreach. We try to sit down with our local jurisdictions regularly and they kind of throw up our hand and say, hey, when you have these cases, please call us. We can help you investigate, or we can take the cases outright. And then we can also prosecute them in-house as well. We've done a lot of outreach with the Department of Public Health, with the Ombudsman's Office, some community groups, even bank fraud investigators. There's some associations in South Carolina. Well, a lot of times with these financial exploitation cases, it may actually start at the bank. You might have someone bringing mom or grandmom to the bank and withdrawing $20,000 in cash. And that bank teller often sees that maybe our victim has some Alzheimer's or dementia or some cognitive disabilities or issues that they might actually notice first. So we are starting to get referrals from our outreach partners. And then I think there's been a renewed focus in the past few years with some elder abuse and elder related crimes. And I think that has kind of helped with the reporting. I don't know statistically if we can say it's on the uptick as a whole, but I think reporting has gotten a lot better, at least in South Carolina.
Well, and I can also say for me to be able to connect with your office, it was very simple. I called up there and I spoke to one of the administrative assistants and they said, this is what you
Mhm.
do. This is how you do it. And I received a response back very quickly from one of your investigators saying, we've got the case. We have some questions. I was responding to some of those questions. And then ultimately, I received a letter via email from you. And so I was very surprised by how quickly things were moving because, my mom's case was in Pennsylvania and it did not move that
Mhm.
quickly. I can promise you that. But they are built differently though, like as far as structure is concerned and things like that. They had different programs, et cetera. But even on the investigative side, it was much more slow. Here, you guys tapped in and responded. Your investigator responded because I would ask questions, how's it going? Because she was looking into things. And then ultimately I got the letter from you. So that's a pretty big thing when you're trying to advocate for people or you're trying to get help, is that the people on the other side actually read your messages that are sending in. And one of the other things that I found out about with my mom's case, and I don't mean to spring this on you, so I apologize, was that I
That's okay.
found out that there's in a special FBI portal to report fed elder abuse crimes directly to the FBI. I found out
Mhm.
about it because my personality, if you will, because I'm a public figure, my Facebook got hacked. And because I'm a public figure, you can't do, that's cyberbullying, right? You could file a complaint with the FBI for that. So when I was doing that for myself because of all this nonsense, I found that portal for the FBI. And I was like, wow, this is really cool. Have you ever worked on cases? I know you can't talk specifics. It just popped into my head. So I hope I'm not
Uh,
being annoying. But
occasionally we do get referrals from the FBI.
okay,
We
yeah,
get them
that's what I
from
was
FBI,
wondering.
Department of Justice. We get them from a lot of places. We'll take them from the public. We have a hotline. It's 1-888 no cheat. We also
Okay.
have our website as well. We take call-ins. We take them from every source, but here in our unit, I can speak for us, and it makes me so proud to hear positive interactions with our unit. But the reason that happens is because we have a lot of people who care here. The people that are in VAMP have a passion for the work that we do, and they take it very seriously. And we do look at every referral that we receive. It gets vetted for jurisdiction. There's so many times that I want to open up a case, but we don't have jurisdiction or we don't have the funding to open them. And that's unfortunately the constraints that we have with some cases. But if we can't establish jurisdiction and we can't open up a case if it looks like something that we can pursue criminally, we're going to open up that case. We don't do any regulatory, any policy. We are strictly criminal. Ultimately on criminal cases, we put people in jail and we prosecute them for felonies. That is the cases we open. So anything
Yeah.
from financial exploitation all the way to neglect involving fatality.
And with your team, the way it's been built, the fact that you have a pharmacist, which is unheard of in all the states, really. And then the nurse, that's so important because a lot of these things, people sell the medicine, they steal the
Yeah.
medicines that the elders are on, literally like perks and whatever else. Like in our case, we knew that it didn't get up to your level because it was
Mhm.
it was because of where the person was located in the system. But the kid was stealing prednisone from her because it was her son that was the perp and was selling the actual drugs just on the street to make some extra bucks too. So I think the fact that you guys have the forensic accountants, those people are no joke. They like peel back that onion and they keep going and going and going and they find everything like the IRS. And
Yep.
then you have the medical personnel in there, plus all the law and everybody's law enforcement. I think it's just amazing how you've assembled this team. This is quite
Yes. And
extraordinary.
it's a national model. There's several Mafukus throughout the country that kind of operate very similar to that we do. There's some that do not. There's some that are non-criminal. They just focus on Medicaid provider fraud. They have very little vulnerable adult component to them. That's not how we operate. We rebranded about 2 years ago as an office. Wilson changed our name in June of 2024. We go to do law enforcement outreach. Hey, I'm from the Medicaid Fraud Control Unit. It's kind of hard to get that vulnerable adult to stick. So, we put that in the beginning of our name. That's about the majority of the cases that we're working on are vulnerable adult cases. We still have those provider fraud cases. Those are very important as well because there are some human aspects as well with those cases that they cause, a lot of people harm in the state. But it's good to hear some positive feedback.
Well, thank you. We've already reached our time. It goes by very fast. I told
It
you.
goes by lightning quick, and I have so much more I want to talk about.
Yes. So we'll have to have you on if you would be open to coming back on because
Absolutely.
I really think, first off, sincerely thank you because I know you're very busy. You have a big caseload. You've got people trying to get into your office constantly. That's why I have your headphones on because they're knocking on the door, trying to get bust in there to talk to you about some important case that they're working on or whatever's happening. So I really appreciate you agreeing to be on and to talk
Oh,
with me
absolutely.
today.
To
Because
do it
this is
again.
Thank you. We'll schedule you back on. This is important. I think education is key here, and that people
Oh, absolutely.
understand that an organization like yours is out there and you're listening. That's the most important is that you're listening. You guys really do listen to everybody who calls in and try to figure out a way that you can help them, which is very commendable.
Thank you. The more we can do to bring some of this to the light, the better outcomes we typically see with our victims and that preventative measure as well.
Well, thank you. Thank you again for joining us. And remember, everyone, this is Humanitarian Horizons. I am Christina DiArcangelo.